Hi, this is Eric Ruderman from Northwestern University in Chicago, and I'm coming to you from the EULAR meeting in Milan for Room Now. I have been tasked with looking at some of the psoriatic arthritis abstracts, and the first one I wanted to talk about was one that was a bit of a surprise yesterday. It was actually a bit of a combination abstract, and the goal was to look at the risk of interstitial lung disease in both rheumatoid arthritis and psoriatic arthritis. This was oral abstract number 6 at the EULAR meeting this year. And I'm going to focus on the psoriatic arthritis piece. It comes from 5 Nordic countries who looked at their registers and identified about 50,000 patients with rheumatoid arthritis or psoriatic arthritis, about 20,000 of whom had psoriatic arthritis, with no pre-existing interstitial lung disease. Then followed them out for 5 years in their registry and matched them with age and gender matched controls from the general population. They then looked in the hospital and death registries from those countries to identify interstitial lung disease by specific ICD-10 codes. And the primary goal of the study was to look at the risk of interstitial lung disease with different therapies, and particularly with methotrexate. And the takeaway there was absolutely no correlation between methotrexate use and the development of interstitial lung disease in either RA or psoriatic arthritis. And when they looked at biologic therapies, there were no biologic therapies that appeared to have an increased risk of interstitial lung disease, with the exception of rituximab, which they thought was probably a channeling bias because specific patients potentially with that history got onto rituximab because of the potential use of it in interstitial lung disease. But what I thought was the most interesting piece of this abstract was the hazard ratio for developing interstitial lung disease relative to the general population who were otherwise healthy. And in rheumatoid arthritis patients, it was about a 10-fold increase, which is not a big surprise. But what was a surprise is that they saw a 5-fold increase in the risk of developing interstitial lung disease in their psoriatic arthritis patients compared to the general population. This came as a bit of a shock because we've never really associated psoriatic arthritis with interstitial lung disease. Is this real? I don't know. It's a very large database. The way the data was collected was pretty solid. The one limitation may be that they pulled out interstitial lung disease from hospital and death registries. So perhaps they were only identifying people with really severe interstitial lung disease, the numbers of whom were quite small. So maybe that was what was going on with the hazard ratio. But it's going to have me looking when I get home to think about the possibility of interstitial lung disease in my psoriatic patients. Is it there? I don't know, but we're going to take a look. So that's what I've seen so far at the EULAR meeting in Milan. Stay tuned to Room Now for some more interesting findings from this meeting.